Well, thank you very much, Jackie. I was told that if you want people to do what you want them to do, you don't tell them to do it. But I'll still try and just go through very quickly some of the questions that we think we should be reflecting on. I know that a lot of other things, and Jackie has made a very good summary of yesterday, and we think and hope that Rachel and Audrey will sort of summarize the piece that Jackie has done, and we'll have it in our folder just to remind us on how we're moving. I think as we go forward, we want to look at what we know, what are the most important research questions that need to be addressed. And this has already started coming through as we've been having this conversation yesterday, and we continue today. So, and yesterday I asked that for the participants, if they could please come with what they know, what they're doing, and then we can share it, we can extend the sort of the reference material that we're working on. That will really, really be useful. Secondly, how do we communicate more effectively with various constituencies? And I think we need to add on this on how do we ask? How do we ask and how do we communicate? So that then we can also develop a science of asking and a science of communicating. And from the presentations that are coming, I think this is also something that is coming through in a multi-sectoral perspective, as we said. Now, how do we mobilize the various sectors and stakeholders who have important roles in research, program, and policy development? And here, I'm also reminded that the place of the media in moving the group that we have here and connecting it with the community, and also making what we're discussing, what we are conversing, a political question. I think it's really important so that we can get it onto the political agenda, and it will be useful to reflect as we move forward in this regard. Where are the opportunities to coordinate or collaborate across countries to improve? And Jackie has touched on this, and I think that as we chart the way forward, and this morning Ian was asking me, how are we going to move this? And so we appreciate comments and contributions in this regard. What are the significant barriers and how can they be overcome? And yesterday's presentations did touch on this, and I'm sure that even today we're going to continue to look at this and sort of hone it in to make sure that we have concrete recommendations that are coming from here. And finally, what are the priority items for the prevention agenda going forward? So this is by no means exhaustive, but just to make sure that as we carry forward the conversation today and as we go into the afternoon, we have a sense of what it is, what is the product that we're going to offer at the end of the 2 days, so that when people go back and say, what happened in the 2 days in Kampala, then we should be able to have a bit of ideas. But as I said, I'm not asking you to do it, because if I do, you won't do it. So on that note, we want to move on to the next item. That is the session for today. And I would like to call upon Professor Karim Manji to come over and moderate the session. Professor Karim Manji is a professor in pediatrics at the School of Medicine at Muhimbili University in Tanzania. I had the opportunity to work with Professor Karim Manji as part of a Gates-funded program where they're trying to review the curriculum of training medical practitioners, sort of moving training of medical practitioners in the line of competence-based training. I was asked to be the external evaluator. I hope I did a good job, but since I'm still invited in Tanzania, I think I did not a so bad job. So Professor Karim Manji, it's yours.
And while we're getting the next group assembled, and they can go ahead, the next group of speakers, and come on up, I just wanted to mention something that I meant to say in my earlier time. But when we're talking about prevention of this issue, we have primary prevention, trying to stop this from happening in the first place, intimate partner violence. And one of the ironies of this, of primary prevention in this field, is that we're oftentimes working with the children who have witnessed intimate partner violence in terms of preventing them from going on and enacting that kind of relationship in their own adult years. Then there's secondary prevention, which is when you're finding a problem early. When we were talking yesterday some about screening, that's a part of that secondary prevention, trying to find the problem early and address it early before it gets very, very severe. And then tertiary prevention, which is when we're trying to prevent the long-term, very serious effects down the line. And so those three levels of prevention are all of what we're trying to address in intimate partner violence. So, Karim.